A warm welcome to Decoding iSPAN Moments. Today we have a special guest, Dr. Vivekanand Kustagi. He is a senior pediatrician, over 25 plus years of an experience. He is also a consultant doctor in Rainbow Hospital, Motherhood, Cloudnine. He also does his practice in his own clinic. He is specialized in neonatology, pediatric gastroenterology, and he has published 40 plus articles. And he is also mentoring upcoming doctors. Welcome to Decoding iSPAN Moments.
Thank you for taking me on. It is very exciting to talk to you about this most happening thing and most talked about thing of mental wellness in children and adults.
Since you are a very senior pediatrician and then you do visit a lot of hospital like Rainbow, Motherhood, and then you do your own practice too. So how was your journey, and then how did you get into this profession? What made you to get into this profession?
It's already 40 years of my practice now. I'm 35 to 40 years now. So when I started my MBBS, it was one of the most happening things. Mm-hmm. So I remember ನಾನು ಯಾವಾಗ ಫೈನಲ್ ಇಯರ್ MBBS ಮಾಡಬೇಕಾದ್ರೆ I was posted in pediatric ward. ನಮ್ದು ಏನು ಮಾಡತ್ತಾರೆ MBBS ಮಾಡಿ ಇಂಟರ್ನ್ಶಿಪ್ ಮಾಡಬೇಕಾದ್ರೆ we have 1 year of hospital training ಇರುತ್ತೆ.
Okay.
So 1 ತಿಂಗಳು or 2 months ನಾವು ಒಂದೊಂದು ಯೂನಿಟ್ನಲ್ಲಿ ಒಂದೊಂದು ಡಿಪಾರ್ಟ್ಮೆಂಟ್ನಲ್ಲಿ ಪೋಸ್ಟ್ ಆಗಿರ್ತೀವಿ. So I was fresh out of the pot. ಅವಾಗ ಜಸ್ಟ್ ನಾನು MBBS ಮುಗಿಸಿದ್ದೆ. I was like a new doctor with all wings to fly, and then I was posted in the pediatrics ward. So when the papu bantu, it was having severe diarrhea, full sustagbitittu, and the mother was crying, the baby was crying, and so much commotion. And whatever ಏನೇನ್ ಆಗಿತ್ತು I had read, but na practically apply ಮಾಡಿರಲಿಲ್ಲ because I was just new out of the pot. So then I waited for a moment, thought what to do, and luckily for us, most of our training would be done by our senior nurse, would be our God guide when we are very young. So she said, Doctor, ನೀವು ಓದಿದ್ದೀರಲ್ಲ ಮಾಡಿ, ಇದಿದು ಮಾಡಿ ಅಂತ. So I put a IV line ಹಾಕಕ್ಕೆ ಎಷ್ಟು ಕಷ್ಟಪಟ್ಟೆ. Then once the baby became a little all right, you should see the smile on the baby, smile on the mother. I said, wow, this is amazing. Okay. That made me pediatrics. Why not? One of my go-to branch for my future, and that's how my thing started. Now looking back, I think that was the best decision doing, because once the baby becomes sick and it cries, the house cries.
True.
Once the baby becomes all right, the house is happy.
Yeah,
so
exactly.
It is treating the baby and treating tension of the parents more than pediatrics alone.
Yeah.
So that made me to choose pediatrics.
Okay. Why did you choose as a medical as a career?
See, every person has a different thing. Idರಲ್ಲಿ ನಮ್ಮ ಮನೆಯಲ್ಲಿ my dad was my mentor, ಈಗ it's everything is different. ನಮ್ಮ ಕಾಲದಲ್ಲಿ ಏನಿತ್ತು, ಅಪ್ಪ ಹೋಗಿ ಜಂಪ್ ಮಾಡು ಅಂದ್ರೆ ಜಂಪ್. ನಮ್ಮಪ್ಪ wanted to be a doctor, so he could not. So he said, ನನ್ನ ಮಗ ಡಾಕ್ಟರ್ ಅಷ್ಟೇ. So that was the initial thing. And I didn't have anything good, so I said, Papa wants me to become a doctor, let me try. Adre fine. If I don't get it, maybe I was thinking of going to defense.
Okay.
That was my thing. Touch wood, everything went fine. Then I got a seat and then went forward.
Okay.
So after joining MBBS, there were so many, role models for me. Then I thought, oh, very good. So 11th, 12th nalli, I did not have any goal, but Papa put me that side. But after that, I thought it's a good decision. But now, kids are very focused. They know 8th standard, 9th standard, they know what they want to become.
Yeah.
This is because of the exposure which we have.
Correct.
See, I've seen both, ends of, you may call it as generation gap. We know when in our generation, we were handheld.
True.
Now, kids handheld the parents and tell them nange ಅಲ್ಲಿ ಕರ್ಕೊಂಡು ಹೋಗು ಇಲ್ಲಿ ಕರ್ಕೊಂಡು ಹೋಗು ಅಲ್ಲಿ ಮಾಡು, I want to do it. So that's nice for nowadays kids to get exposed.
So exposure, basically, there is another problem, as you said. So exposure, they have lot of information. So now they are also getting confused which one we need to choose. So these are the two extremes.
This is again a big challenging thing for us. Egenagate, exposure is good. Too much exposure is bad.
Yeah.
Alva? See, in sort of anything.
Yeah.
See, nowadays kids have got so much exposure, they know what to do, but they also get confused.
Yeah.
Should I do it or should I not do it? And egenagate, you should allow the thing hombek antaralla.
Yeah.
Hommadre tane you have an end result.
True.
ನೀವು ಹೋಮ್ವರ್ಕ್ಕಿಂತ ಮೊದಲು ಜಾಸ್ತಿ ಹಾಕ್ಬಿಟ್ರೆ ಜನರಲಿ ಕೆಲಸ ಕೆಡೋ ಚಾನ್ಸಸ್ ಜಾಸ್ತಿ.
ಹೌದು.
ಬಟ್ ವಾಟ್ ಐ ಜನರಲಿ ಅಡ್ವೈಸ್ ಮೈ parents and my young kids who come to the clinic or hospital ask me, sir, I'm in that spot, I don't know what to decide. What I tell them is keep an open mind.
Yeah.
Take in data, process the data, see what things you feel good. I got ನನ್ನ ಹತ್ರ about 4-5 ಮಕ್ಕಳಿದ್ದಾರೆ who come follow me up. See, example 11th 12th ನಲ್ಲಿ they see me, they want to become a doctor, and what I tell them, do you want this for your life? So please shadow a person who is successful for about a week, 10 days.
Yeah.
See how you feel. Oh, I want to become like that, then please go ahead. Once you jump in, you can't come back.
True.
So that's the reason I tell kids, especially 11, 12 who are going, maybe in the holidays, shadow a successful lawyer, shadow a successful doctor, shadow a successful psychologist, whatever you want to become. Try to see how their work life is. Do you, next 10 years, you see your position in them, do you want to be there? Then please go ahead. If you don't like it, then you can always stop there. That's the time you can come back. So that's what I tell most of my kids who ask me 11, 12 what to do. Definitely shadow a person.
Exactly. This is basically one of the good idea. Ideally, what happens is, see, now even though we talk about career counseling, in career counseling we talk about there are 450 plus careers. So it should match API, we say, aptitude, interest, and personality. This is where shadowing would help them. See, today getting into medical is about attending entrance exam, clearing those exams, and when they get into exams, clearing educational aspect is one, and then pursuing the profession is another biggest task. So here, being a doctor, so they have to be open, and then they should be available all the time, right? And then they should have a passion and interest. So it is not about, okay, this month is like this, or this year will be like this, next year, okay, I can change. Because as you have mentioned clearly, so it is for a lifetime. Being a doctor is not an easy decision. Before they get into this medical field, they should actually taking this shadow would really help. Today, there are a lot of aspiring doctors outside, right? For them, basically, to understand your journey. So right from the beginning stage, and then this 25 years, how was your journey?
See, journey for it's been a very long journey. That's amazing. When I look back, there are a lot of ups and downs. So as a student, when I joined MBBS, I still remember my getting into the college, first time sitting in the class, then going through the classes, everything going above the head, ಏನು ಗೊತ್ತಾಗ್ತಿರ್ಲಿಲ್ಲ, what to do, taking friends' help. First break was the first test. When the test came, first 2 months, PUC ಆದ್ಮೇಲೆ ನಾನೇ ರಾಜ, ನಂದೇ ಎಲ್ಲ ಬಂದ್ಬಿಡ್ತು, MBBS ಒಳಗೆ ಸೇರ್ಕೊಂಡ್ರೆ ಕೆಲಸ ಆಗೋಯ್ತು ಅಂತ. Then our realization knocked. It's not this, that's what it starts.
Yeah.
First test, you have 20 books to study, and you're not started, and you don't know what to do. Your friends have studied, you're not studied. So a lot of peer pressure, competition, lot of subjects, ಆ್ಯಂಡ್ ಏನಾಗುತ್ತೆ, ನಾವು MBBS ನಲ್ಲಿ ಫೇಲ್ ಆದರೆ ದೇರ್ ಇಸ್ ನೋ ಕ್ಯಾರಿ ಆನ್ ಸಿಸ್ಟಮ್.
Oh.
That was the thing that was there in my time, and now there is a little flexibility. So now first year MBBS ನಲ್ಲಿ we were 200 people. ಅದರಲ್ಲಿ 24 of us passed, remaining all flung. That was the saddest day of my life because I was the only person passed and all my friends had failed. Like ಎಷ್ಟು ಬೇಜಾರಾಗೋಯ್ತು ಸರ್, ಎದಕ್ಕೆ ಪಾಸ್ ಆಗಿದೆ ಅಂತ ಸಖತ್ ಬೇಜಾರಾಗೋಯ್ತು. ನಾನು ಒಬ್ಬನೇ ಪಾಸು, ಎಲ್ಲ ಫ್ರೆಂಡ್ಸ್, ಆಲ್ ಮೈ ಫ್ರೆಂಡ್ಸ್ ಫೇಲ್ಡ್. ಸೊ ದೆನ್ ಹ್ಯಾಡ್ ಟು ಮೇಕ್ ನ್ಯೂ ಫ್ರೆಂಡ್ಸ್ ಇನ್ ದಟ್ 24. ಆ್ಯಂಡ್ ನಾವು ಅದರಲ್ಲಿ ನಮ್ಮ ಕ್ಲಾಸ್ನಲ್ಲಿ ವಿ ವೇರ್ ಅಬೌಟ್ 8 ಬಾಯ್ಸ್, ರಿಮೈನಿಂಗ್ ಆಲ್ ಗರ್ಲ್ಸ್. ಆ್ಯಂಡ್ ದೆನ್ ಆಫ್ಟರ್ ದ್ಯಾಟ್ ವಿ ಸ್ಟಾರ್ಟೆಡ್ ಕ್ಲಿನಿಕ್ಸ್. ಕ್ಲಿನಿಕಲ್ ಶುರು ಆಯಿತು, ವೇರ್ ಪೇಷಂಟ್ ಎಕ್ಸ್ಪೋಜರ್ ಸ್ಟಾರ್ಟೆಡ್. Every patient has a different problem. I was posted in one of the government hospitals. ಅವಾಗ ಒಂದು ಪೇಷಂಟ್ ಬಂದರು, ಆ ಪಾಪುಗೆ ನಾಯಿ ಕಚ್ಚಿತ್ತು. ನಾಯಿ ಕಚ್ಚಿದಾಗ, ಸರ್ ನಾಯಿ ಕಚ್ಚಿದೆ, ನಾಯಿ ಕಚ್ಚಿರೋ ಇಂಜೆಕ್ಷನ್ಗೆ ನಾನು ಬಂದಿದ್ದೀನಿ ಅಂತಂದ. ಸೊ ಐ ಸೆಡ್, ಯಾಕಪ್ಪ ಇಷ್ಟು ದೂರ ಬಂದಿದ್ಯಾ, ನೀ 10 ಕಿಲೋಮೀಟರ್ ನಡ್ಕೊಂಬರ್ಬೇಕು, ಅಲ್ಲೇ ನಿಮ್ಮ PHCನಲ್ಲಿದೆ, ಅಲ್ಲೇ ನಾಯಿ ಕಚ್ಚಿರೋ ಇಂಜೆಕ್ಷನ್ ಹಾಕಿಸ್ಕೋಬೋದಲ್ಲ ಅಂತಂದು ಹೇಳಿದೆ. ಅವನೇನಂದ, ಸರ್ ನಾ ಕೆಲಸ ಮಾಡೋನು, ಅಲ್ಲಿ ನಾಯಿ ಕಚ್ಚಿರೋ ಇಂಜೆಕ್ಷನ್ ಕೊಡ್ತಾರೆ, ಸಿರಿಂಜ್ ಕೊಡಲ್ಲ ಸರ್. ಸಿರಿಂಜ್ ನನಗೆ ₹1 ಆಗುತ್ತೆ, ನಂಗೆ ₹1 ಗಳಿಸೋಕ್ಕೆ ಕಷ್ಟ ಆಗುತ್ತೆ, ಅದಕ್ಕೆ ನಾನು 10 ಕಿಲೋಮೀಟರ್ ನಡ್ಕೊಂಡ್ಬಂದು ಆ ಸಿರಿಂಜ್ ಇಲ್ಲಿ ಫ್ರೀ ಸಿಗುತ್ತೆ, ಸಿರಿಂಜು ಇಂಜೆಕ್ಷನ್ ಹಾಕಿಸ್ಕೊಂಡು ನಡ್ಕೊಂಡು ಹೋಗ್ತೀನಿ ಅಂತಂದು. ಸೊ ಅವಾಗ ಏನಾಗುತ್ತೆ, ವಿ ರಿಯಲೈಸ್ ನಾವು ₹1 ಅಂದರೆ ನಾನು ಆ್ಯಸ್ ಅ ಪರ್ಸನ್, ನಾವು ₹1 ಐ ಡೋಂಟ್ ಕೇರ್. ಆ ಪರ್ಸನ್ 10 ಕಿಲೋಮೀಟರ್ ನಡ್ಕೊಂಬರ್ತಾನೆ, ಒಂದು ಇಂಜೆಕ್ಷನ್ ಹಾಕಿಸ್ಕೊಂಡು ಹೋಗ್ತಾನೆ, ಆ್ಯಂಡ್ God has given us. So avaga I started realizing God has blessed me.
Yeah.
There's so many people who are not blessed like me. So every rupee is important and everything is important. So when you are a doctor, you really see variety of patients. Then you really know what is life, kashta eno, tondre eno. See, when a person is going to die in 1 month, he knows he's going to die, you know the importance of every second.
True.
Alva, if you otherwise you don't even bother about 1 second in your life.
Exactly.
It's really amazing when you see different patients, different ways what they go through is amazing. And as you grow up the ladder, what happened, ಒಬ್ರು gynecologist ಇದ್ರು, very successful gynecologist. I used to adore her, see her, wow, I want to be like her. She was in a peak of her career. She was diagnosed pancreatic cancer. Next month she died.
Oh.
So that made me realize, pause, what am I doing? I'm running like mad.
True.
So everything changes your life decision making. So it's been a wonderful journey till now. Getting so much exposure to different patients. Having every day is a new experience. You see new things.
Yeah.
You learn new things. It's nice.
So I do have a very curious question. You have completed 25 years of a practice. So ideally, everybody, because when I visit, there are 100 people who are waiting, right? Out of 25 years, do you know how many consultations you have done? Approximately.
Andre, see, if you look at maybe 100 patients per day into 25 years, that many number of people I have seen.
Wow.
And when we were in college, 100 would not be the number, it would be 500 to 800 in a day. That's the numbers we used to see. Everything would be, you know how the government colleges work, 10 jana irtare one point of time. And you don't know what to talk, where to talk. Ega, it is little better. Nam time nalli there were hardly any medical colleges. When I did my masters from Madras, whole Madras had whole Chennai had only 4 medical colleges then.
So talking to these parents today, the biggest challenge, right? So for you, each patient is different. So for them, there is one doctor. Everybody, they come to you, ಅವ್ರು ಕೇಳೋ ಕ್ವೆಶನ್ನು, ಡಾಕ್ಟ್ರೆ ಇವಾಗ ಏನು ಮಾಡಬೇಕು, ನೋವಾಗ್ತಾ ಇದೆ ಇವಾಗ ಏನು ಮಾಡಬೇಕು, ಪ್ರಿವೆನ್ಷನಿಗೆ ಏನು ಮಾಡಬೇಕು, ಬಿಕಾಸ್ ದೇ ಹ್ಯಾವ್ ಲಾಟ್ ಆಫ್ ಕ್ವೆಶನ್ಸ್ So how do you manage your patients?
So eega, see, nowadays parents are very, very well read. That's one thing. But problem is they are educated, but they're not medically educated to understand anything. Especially I'm talking of nowadays well-read techie parents or who have a lot of access to anything. So if I tell A, they would always Google it, see A, understand what is A, and think of the side effect, and then give. Example, ನಾನು ಒಂದು ಪಾಪು ಕ್ರೋಸಿನ್ ಕೊಟ್ಟೆ. ಮೊದಲು ಏನಾಗ್ತಾ ಇತ್ತು, ಕ್ರೋಸಿನ್ ಕೊಟ್ಟರೆ ಸುಮ್ಮನೆ ತೊಗೊತಾ ಇದ್ರು. ಈಗ ಕ್ರೋಸಿನ್ ಕೊಟ್ಟರೆ ಕ್ರೋಸಿನಲ್ಲಿ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಏನಿದೆ ಅಂತ ನೋಡ್ತಾರೆ. Whenever we give one paracetamol kotre, there is always a theoretical chance that you may have liver failure. That doesn't mean that you will not stopping paracetamol, right?
Yeah.
So nanu aushti paracetamol kotte, and then they say liver failure agata doctor, and I can't tell no. When I tell yes, would you take paracetamol? Right?
Yeah.
So athara, see, every parent has a anxiety level, everything is there. But as a doctor, we have to counter that anxiety. That's very important for us, because that's the part of our trade.
Yeah,
now, as a doctor, if a parent is anxious, if he's worried, I can't be again anxious I can't be against his anxiety. I have to be, I have to soothe him.
Yeah.
I have to support him. I have to take care of his anxiety. Then only my work is fulfilled. Otherwise, if I am stressed, I start kopa madkondre, there's no point. The whole concept of me working so as a doctor would go for a toss.
True.
One thing. But nowadays the parents, as I told you, 90% is psychological support.
Okay.
10% is medical support. That's what it is. Because most of the things is viral infections most of the times, which is self-limiting, where patients should have patience to get over it. Where parents help, they have a little anxiety issues.
At times we also get calls. People would ask, do you do CBT? Do you do this? Do you have this facility? And then the self-diagnosis have increased. So that is where ideally what happens is, the psychosomatic at times. So maybe there is nothing, but when they read article or anything, they started feeling okay. Idirಬಹುದೇನೋ, ಇದಾಗಿರಬಹುದೇನೋ, ಈ ಥರ diagnosis. So yes, it has pros and cons. And then hats off to you, because you have a lot of patience, because in a day, if you are meeting 100 people, 100 parent. So you have to manage 100 parent, and then in between you have to visit multiple hospital too. So may I know your routine? So ideally, how do you start your day? And then
see, generally any doctor is generally very busy. So important thing for us is our mental health, physical health.
Yeah.
For us to maintain, to take the grind, very important. So ಏನagate, when we were young, that means when I was in my 20s or 30s, I never thought of my mental health. I never thought of physical health, which most of the people do it the same way. Once you reach 30s, 40s, then you start thinking on that. I should look at my physical health. I should look at my mental health. Every 10 years, whatever we think would be different. When I'm 20, my thinking is different. My 30, my thinking is different. When I'm 40, thinking is different. Now, definitely, now kids and people are changing.
Yeah.
They are also thinking of physical health, mental health, well-being, longevity. See, always na ellargu heltini. What I tell, everybody is getting old. Everybody will become old. It's how we become old is very important.
Yeah.
That is very important. Andre ಆ ಎಲೆ ಹೆಂಗೆ ಹಳದಿ ಆಗತ್ತೆ, it can become yellow like that or slowly yellow ಆಗೋದು.
Okay.
So for that, how we live when you're 30, 40, that's how you would be in 60s and 70s.
True.
So that's very important. So what generally I advise, definitely I can't, if I tell ಇಲ್ಲ stress ತಗೋಬೇಡಿ, ಚೆನ್ನಾಗಿ ತಿನ್ನಿ, ನಿದ್ದೆ ಚೆನ್ನಾಗಿ ಮಾಡಿ ಅಂದರೆ it's not going to happen practically. But what I suggest, whatever challenges you get in life, don't take it to your mind. You have a challenge, you have to face it, face it. Take enough of rest as much as possible. Eat well, have a lot of fluids. See, what happens is, I can tell you eat this protein, this carbohydrate, this thing and things like that. But if I tell you all those, practically, it puts a lot of strain on the kitchen. See, ಏನಾಗುತ್ತೆ ಮನೆಯಲ್ಲಿ ನಾ ಇತ್ತಿನಲ್ಲ ಇದೇ ಅಡುಗೆ ಮಾಡು, ಇತ್ತಿನಲ್ಲ ಅದೇ ಅಡುಗೆ ಮಾಡು ಅಂದರೆ ಪ್ರಾಕ್ಟಿಕಲಿ ಆಗಲ್ಲ. ಸೊ ವಾಟ್ ಐ ವುಡ್ ಸಜೆಸ್ಟ್, ಈಟ್ ನಿಮ್ಮ ಹೊಟ್ಟೆ ಯಾವಾಗ ತುಂಬತ್ತೆ ಸ್ಟಾಪ್ ಮಾಡಿ. ಡೋಂಟ್ ಓವರ್ ಈಟ್. ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್, 20 to 30 minutes of exercise for your body. ನಾನು ಎಕ್ಸಸೈಸ್ ಅಂದ ತಕ್ಷಣ ಸರ್ ಬ್ಯುಸಿ ಇದ್ದೀನಿ, ಆಗಲ್ಲ, ಕೆಲಸ ಇದೆ, ಆಗಲ್ಲ. ಇಟ್ ಈಸ್ ಫೈನ್, ಕೆಲಸ ಎಲ್ಲರಿಗೂ ಇರುತ್ತೆ. ನಿನ್ನ ಬಾಡಿಗೆ 20 to 30 ನಿಮಿಷ ದಿವಸ ಕೊಡಲೇಬೇಕು. ಎನಿ ಫಾರ್ಮ್ ಆಫ್ ಆಕ್ಟಿವಿಟಿ, ಎನಿ ಫಾರ್ಮ್ ಆಫ್ ಎಕ್ಸಸೈಸ್, ಎನಿ ಫಾರ್ಮ್ ಆಫ್ ಥಿಂಗ್ ವಿಚ್ ಎವರ್ ಯು ಲೈಕ್. ಮೇ ಬಿ ಅ ವಾಕ್, ಮೇ ಬಿ ಅ ರನ್, ಮೇ ಬಿ ಅ ಸ್ಟೆಪ್ ಕ್ಲೈಂಬ್, ವಾಟ್ ಎವರ್. ಆ್ಯಂಡ್ weekly once or twice think of your mental health. Very important. Mental health, what would I do for my mental health? I would do only 5 minutes of meditation or 5 minutes of one jagrat kutkon kanmuchkontini. Let whatever thoughts come in. So that I have some mental stability. Something, if I want to vent out something, always have 1 or 2 friends, good friends, who are ready to listen to you. Maybe your wife, maybe your close friend. So venting is very important in your life. If you don't vent out your thing, it will start pulling up. Then you'll have all stress. It may be anything. It could be a small car dent also, or it could be a patient which you thought you could have done better, or somebody who has put stress on you. Just vent it out. That's very important. Never keep anything in your heart.
True. I mean, so this is the key. Today, the biggest challenge with this generation or people venting out, having a good friends. We used to say 2 a.m. friend. We don't have. Nowadays, there is no friends at all, because in their social media, they might be having 5,000 friends, but in their real life, I always say there is no friends, because there is a trust issues or they don't share. So venting out, yes, exactly. So this is where maybe a psychologist would help. The venting out, maybe they go and talk. So to the biggest challenge, the perspective. And then you spoke about the meditation. And then since you are from a medical background, you know how to control, right? You know how to maintain maybe your routine. So ideally, this is where today at times we hear from people, I don't know how to control the thoughts. So again, the consistency, and then the problems, or maybe the venting out. There's a whole, again, it is a chain.
So mental health issues, see, now it's already 3 decades. About 10 to 20 years back, we were never talking of mental health issues. So we were thinking of more of physical health, more of infection, more of problems. Now, there is a sudden surge of kids who are coming in with a lot of mental health issues. Mental health issues could be anxiety. They come with aneurysms, bedwetting. They come with headaches. They come with stomach pains, and they come with cough. Some kids come with continuous cough, which as a parent, you think he's got some problem. But actually it's a psychological problem where the kid is asking for attention. So these attention-seeking behaviors, all these mental issues have increased by more than 25 to 30%. Okay? And as you know, phones, iPhones, addiction, your things, they have also increased a lot. Actually, Nimansnalli, there's one word for phone addiction. To de-addict the kid with phones. So, example, it's so bad, like seeing a reel, seeing a phone. What they've done a study where if phones noಡ್ತಾರಲ್ಲ, so what it stimulates a part of your brain that causes addiction. It's something similar to a drug addiction. So they saw drug addicts, kids with phone addicts. Okay, they read their brain mapping. When they saw that, the same part of the area was getting stimulated.
Okay.
Okay, so it's as bad as a drug addict, the phone addiction.
Okay.
So these mental issues are going to rise now. ಯಾಕಂದ್ರೆ ಈಗ ಏನಾಗುತ್ತೆ, single families,
True.
no friends, lot of media. So mental health is going to be a big thing for the future than on your physical health.
So today it's a AI era. People are talking about AI, right? What is the difference between, ideally, since you might have come across these situations already, you have mentioned, where people will Google it. So if you prescribe something, if you are going with AI, and then they just go and Google and they say, basically, is there any side effects? In the same fashion, people are more using AI. What is the difference between an AI nutritionist and then the professional nutritionist who is available online? I mean, face to face.
Okay. Nutrition now, ಏನಾಗುತ್ತೆ, in India we have two stratas. One is a rich strata where they have AI, they have so many things, information. Then they start doing. We have people with a mid and a lower class where their nutritional approach is different.
Yeah.
Their approach would be ಅಜ್ಜಿ ಹೇಳ್ತಾರೆ, ಅತ್ತೆ ಹೇಳ್ತಾರೆ, ಅಕ್ಕಪಕ್ಕದ ಮನೆಯವ್ರು ಹೇಳ್ತಾರೆ, ನಾ ಅದು ಕೊಡ್ತೀನಿ ಅಂತ. ಸೊ ಈಗ ವಿಲ್ ಗೋ ಟು ದ ರಿಚರ್ ಕ್ಲಾಸ್. ಏನಂತಾರೆ, ಜನರಲಿ ನ್ಯೂಟ್ರಿಷನ್ ಹೆಂಗೆ ಮಾಡ್ತಾರೆ ಅವರು. ಸೊ ವಾಟ್ ದೇ ಟೆಲ್, ಸೊ ಜನರಲಿ ದೇ ವುಡ್ ಗೂಗಲ್, they would see what's the best for the baby, and they would have some preset ideas, and maybe they have some ideas from friends, and they start giving nutrition to a baby. So example, a rich mother or a well educated mother at a 6 months time, ಏನು ಕೊಡ್ತಾರೆ ಅವರು, they give some product like a Cerelac or some product which is readily available.
Yeah.
Which has high sugars, which is from the shelves, which is okay, but not as great as our traditional thing. A halli mother who is 6 months of papuna, when she wants to give, our ajji ಏನು ಹೇಳ್ತಾರೆ, ರಾಗಿ ಸರಿ ಕೊಡಮ್ಮ, ಅದಕ್ಕೆ ಸ್ವಲ್ಪ ಬೆಲ್ಲ ಹಾಕಮ್ಮ, ಸ್ವಲ್ಪ ಗೋಡಂಬಿ ಬಾದಾಮಿ ಹಾಕಮ್ಮ, ಆ ಸರಿ ಮಾಡಿಕೊಡು ಅಂತಾರೆ. So you think Cerelac is great or ragi seri is great? Right?
Yeah.
So I'm not telling you it's bad, but definitely we have to balance between both. You have to take in your adults, your tradition, and also take into your tech and your data into place. But over a period of time, what we have seen, than under nutrition, we are seeing obesity.
Yeah.
We are seeing micronutrient deficiencies. We are seeing micronutrient deficiencies, which are massive. See, people having a lot of iron deficiency, where iron deficiency can cause attention deficit. It can cause reduced intelligence deficit. They can reduce immunity. It can cause recurrent infections. Obesity, as you know, it can cause insulin resistance. It can cause diabetes.
Yeah.
So there's so many diseases that come with micronutrient deficiency. So what I would suggest, talk to your doctor also about nutrition, also learn yourself, and then plan on the kids' diet. And see, what happens is, plan according to your family diet. See, again, you can prepare something special meal for the baby once or twice.
Yeah.
Practically, you can't be cooking it every day, right? So you have to plan it according to your whole family, and say that the family would also be benefited from the kids' diet.
So basically, yes, we from this discussion, we understand there is a clause, right, where they have an access to all this AI, right, and then information, then they follow certain diets, and then another class where they go with tradition and then what people talk about. Today, basically, the nutrition as a profession, also we are seeing there are a lot of people, they are completing their nutrition, the course and becoming a nutritionist. So then we should look at nutritionist, somebody who can understand our food habits. So because it is not like that, okay, from tomorrow onwards, I should not being a nutrition saying, okay, there are fancy items, this is what you have to buy. Because at times there are, people who have approached us, sir, can you get this product from US? Because this is not available. My nutritionist has, suggested this product. So those who are watching this podcast, basically, so when you are consulting any nutritionist as such, you should look at, so they should understand your food habits or each, because in India we have a lot of diversity in terms of religion, and each religion would follow different food culture. So somebody who can understand and then suggest those nutrition is great. And again, yes, also you have mentioned obesity and then ADHD, right? And even deficiencies and then immunity. This is actually creating a lot of the problems at the early stage. So today in India, because in one of the podcasts also, I always talk about, we should look at the grassroots level. We should look at we should not do any firefighting. Already those who are already grown, yes, we have to address. But when we look at the grassroots level or the root cause, so this education should happen right from the childhood, or basically from it has to be inculcated in the education. The well-being concept should be introduced right from the school. So where we can talk about, we can avoid this obesity, because that's where we have to mold them. So curriculum talk about a lot of other things, right? So they study everything, maybe social studies, science, maths, and everything. Along with that, if they are concentrating on well-being, today even you have mentioned the mental health issues or the concerns are significantly raising. So compared to some 20 years ago. So maybe in the school or in the sports academy. So if we introduce this well-being, would really help children.
See, definitely it would help. And I will go one step further. The well-being has to be introduced in the family.
Yeah.
See, if a father is sleeping and seeing TV and tells son, go for a run.
Okay.
See, he eats chips and pizza and tells son, don't eat it. It's not going to work.
Yeah.
Right. So the well-being concept, definitely in school, definitely. The same concept has to be extended to the family. So that I would suggest, if there's a parent-teachers meeting, they should also add in a well-being thought for the parents who come in.
Yeah.
See, when ಏನಾಗುತ್ತೆ ಬರ್ತಾರೆ ನಮ್ಮ ಸ್ಕೂಲ್ನಲ್ಲಿ ಒಂದು ವೆಲ್-ಬೀಯಿಂಗ್ ಕಾನ್ಸೆಪ್ಟ್ ಇದೆ, ಮಕ್ಕಳಿಗೆ ಮಾಡ್ತಿದ್ರೆ, it should not be at the school and then stop it and then go from there.
Yeah.
So it has to continue from school to home.
True.
Very important. So well-being in the form of one, nutrition, mental health, physical. What is well-being? It is basically well-being in the form of everything, from your mental health, physical health, nutritional health.
Yeah.
So when everything comes together, then the well-being happens.
True.
So we have to educate parents and children and then go from there. And it should be a continuous process. It's not, as you said, molding.
Yeah.
That's how it has to get molded.
Yeah.
It's not going to happen overnight. It will take years
Exactly.
for that to happen. So, and over a period of time, from parents to grandparents also, because to learn something and unlearn it and learn something new, it's tough.
Yeah.
So ಯಾರ ಮನೆಯಲ್ಲಿ ಯಾವುದೋ ಒಂದು ಕಾನ್ಸೆಪ್ಟ್ನಲ್ಲಿ ಹೋಗ್ತಾ ಇರ್ತಾರೆ. If that concept is wrong, for us to tell it's wrong and learn new thing, it's a challenge.
True.
To unlearn and put something new, we have to put in effort.
True. So basically this triggered me another question. We spoke about obesity, we spoke about nutrition aspect, we spoke about mental health aspect. So today, being a pediatrician, so there are a lot of myths people would think about. So how do I identify a healthy baby? So because what I heard, people would talk about, if the baby is chubby, right, and then he is healthy, or maybe a baby is thin, then they are really worried about. And at times I have seen my friends, they would be asking question. So he is 3 years old, he is 4 years old, he is underweight, and then they say there is no changes in the weight even though he eats well, even though we concentrate on his nutrition or her nutrition, but there is no changes. And then when we consulted with the doctors, doctor says your baby is healthy. But even though they are not satisfied, when they get consulted with us, when they have a discussion with us, they say these are some of the concerns. Yes, of course, this is the parent anxiety. So can you explain some of the myths?
So, myths are many. So, as you rightly said, chubby baby doesn't mean he's healthy. ಯಾವ್ದಾರ ಪಾಪು ಸ್ವಲ್ಪ ಗುಂಡಾಗಿತ್ತು ಅಂದ್ಕೊಳ್ಳಿ, ನಿಮ್ಮ ಪಾಪು ದಪ್ಪ ಅಂದರೆ the parents get upset.
Yeah.
Right? ಅದಕ್ಕೆ that's a concept where it started, ನಿಮ್ಮ ಪಾಪು ಹೆಲ್ದಿ ಆಗಿದೆ.
Okay.
You understand? So, being obese is not great. Being thin is not great. So, now we have something called a growth chart. So, whenever a patient comes to us, we have to plot them on the height scale, weight scale, and head circumference. We have a IAP growth chart.
Okay.
Where we chart them. There's a chart called growth to health chart, where the weight would be categorized from 90th centile to 5th centile. If the weight falls there, that means the baby is healthy. If his height falls in that chart, in the plot, then it's healthy. Head circumference it plots, then it's healthy. I'm talking medically.
Okay.
If the growth chart, if there are variations happening, that means that's the time where, as a doctor, we have to intervene. Okay? Parents ಏನಿರುತ್ತೆ, it's always comparison. ನನ್ನ ಅತ್ತೆ ಪಾಪು ಅಷ್ಟು ದಪ್ಪ ಇತ್ತು, ಇವನು ಹಿಂಗಿದ್ದಾನೆ, ಅವನು ಅಷ್ಟು ಆಕ್ಟಿವ್ ಆಗಿದ್ದಾನೆ, ಇವನು ಹಿಂಗಿದ್ದಾನೆ,
ಟ್ರೂ,
ಅವನು ಅದು ಮಾಡ್ತಾನೆ. ನೆವರ್ ಕಂಪೇರ್. ಈವನ್ ಟ್ವಿನ್ಸ್ನಲ್ಲೂ ಕಂಪ್ಯಾರಿಸನ್ ಭಾಳ ಬರುತ್ತೆ. ಒಂದು ಟ್ವಿನ್ ಹಿಂಗೆ ಮಾಡುತ್ತೆ, ಇನ್ನೊಂದು ಟ್ವಿನ್ ಹಂಗೆ ಮಾಡುತ್ತೆ.
ಟ್ರೂ.
ಸೊ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್, ಎವ್ರಿ ಪರ್ಸನ್ ಇಸ್ individual. It's not like every finger is different. You can't expect all the fingers to be the same.
Yeah.
Athara. One, being a parent is quite challenging. They have so many inputs, so many things happening. Food nalli myth ಏನು ಬರುತ್ತೆ, ಕಾಮ್ನೆಸ್ಟ್. ಈ ಆಹಾರ ತಿಂದರೆ ವಾಯು ಆಗುತ್ತೆ, ಈ ಆಹಾರ ತಿಂದರೆ ಉಷ್ಣ ಆಗುತ್ತೆ, ಈ ಆಹಾರ ತಿಂದರೆ ಶೀತ ಆಗುತ್ತೆ, ಅದು ಕೊಟ್ಟರೆ ಗಂಟಲು ನೋವಾಗುತ್ತೆ, ಇದು ಕೊಟ್ಟರೆ ಅದಾಗತ್ತೆ. Nothing like that. There's no food that causes vayu. There's no food that causes gas. There's no food. Example, ice cream tindre gantal nautu. So that's all. As a doctor, if they tell yes, I have to tell yes. But truly speaking, it's not the thing.
Okay.
Okay. So ice cream tindre gantal. Why should it happen? What could happen is, if the ice cream he has eaten can cause a little vasoconstriction, blood supply ಸ್ವಲ್ಪ ಕಮ್ಮಿ ಆಗಿ, it may cause a little congestion ಅಷ್ಟೇ. ಅದರಿಂದನೇ ಇನ್ಫೆಕ್ಷನ್ ಆಯಿತು. It's a myth. See, ಡಾಕ್ಟ್ರೇ ನಾನು ಇದು ಹಾಲು ಕೊಡಿಸಿದ್ರೆ, ಹಾಲು ಕೊಟ್ಟರೆ ಕಫ ಕಟ್ಟುತ್ತೆ.
Okay.
ಸೊ ಅಗೇನ್, ಹಾಲು ಕೊಟ್ಟರೆ ಕಫ ಕಟ್ಟುತ್ತೆ, ಇಸ್ ಅಗೇನ್ ಎ ಮಿತ್. ದಿಸ್ ಅ ಕಾಮನ್ ಥಿಂಗ್. ಸರ್ ಬಿಸ್ಕಿಟ್ ಕೊಟ್ಟೆ, ಅದು ತಿಂದೆ, ಪಾಪುಗೆ ಮಂದ ಆಗೋಯ್ತು. ಸೊ ಅಗೇನ್ ಇಟ್ಸ್ ಅ ಮಿತ್. ಸಿ, these are things where it, over a period of time, it will start coming down. As a doctor, it's our responsibility to tell them that it's a myth.
Okay.
Example, ಪಾಪು ಸ್ನಾನ ಮಾಡಿಸ್ತಿರ್ತಾರೆ, ಬಟ್ಟೆ ಒಗೆಗೆ ಡೆಟಾಲ್ ಹಾಕ್ತಾರೆ to wash the clothes.
Okay.
Right? I don't know why the concept of Dettol started. Once you put Dettol, it's a strong antiseptic. When the baby wears the dress with that antiseptic on, it causes a lot of skin rashes, skin allergies. So actually it's causing more harm. So that Dettol concept will take one generation to go, because that their grandmother was doing, now the new mother is doing.
Yeah.
So don't use Dettol to wash baby's clothes. Whatever washing powder you use, same washing powder at a lesser concentration.
Yeah.
ಮೊದಲು ವಾಟ್ ಹ್ಯಾಪನ್, ನಾವು ದಟ್ ಥಿಂಗ್ ಇಸ್ ಗಾನ್. ಮೊದಲು ಒಂದು 10 ವರ್ಷದಿಂದ ಏನು ಮಾಡ್ತಿದ್ರು, ಕಿವಿನಲ್ಲಿ ಎಣ್ಣೆ ಬಿಡ್ತಾ ಇದ್ರು, ಮೂಗ್ನಲ್ಲಿ ಎಣ್ಣೆ ಬಿಡ್ತಾ ಇದ್ರು, ಬಾಯಿನಲ್ಲಿ ಎಣ್ಣೆ ಕೊಡ್ತಾ ಇದ್ರು, ಮೇ ಬಿ ಟು ಕ್ಲೀನ್ ದ ಇಯರ್ಸ್. ಬಟ್ ವಿ ಸ್ಟಾರ್ಟೆಡ್ ಸೀಯಿಂಗ್ ಲಾಟ್ ಆಫ್ ಲೈಪಾಯ್ಡ್ ನಿಮೋನಿಯಾಸ್. ಎಣ್ಣೆ ಬಿಟ್ಟರೆ ಎದೆನಲ್ಲಿ ಹೋಗಿ ನಿಮೋನಿಯಾ ಆಗೋದು. ಸೊ ಮೊದಲು I'm talking of 10-15 years back, they used to do something called branding. ಇನ್ನೂ ಮಾಡ್ತಾರೆ. ಬ್ರ್ಯಾಂಡಿಂಗ್ ಅಂದರೆ ಇಲ್ಲಿ ಸುಡ್ತಾರೆ.
Okay.
I don't know whether you have seen, ಹಳ್ಳಿ ಕಡೆ ಹೋದಾಗ ಚರದ ಮೇಲೆ ಇಲ್ಲಿ ಸುಸು ಹೋಗೋ ಜಾಗದಲ್ಲಿ ದೇ ಬರ್ನ್. ದಟ್ ಈಸ್ ದೇರ್ ಟ್ರೆಡಿಷನ್.
Okay.
And they till ಅದಕ್ಕೆ ಅದೇನು ಕಣ್ಣಾಗಲ್ಲ ನಜರ್ ಬರಲ್ಲ ಅಂತ.
Okay,
So
okay.
it's called branding. Why do you want to burn a baby for that? There's so many traditional myths we have in India.
So, what is your iSPAN moments?
So the iSPAN moments of my journey, one of my professional colleagues who was a very big gynecologist, and I used to look upon her, and a great thing, I wanted to work like her. Like, she was dedicated, worked 24, seeing a lot of patients and doing very difficult things. Suddenly losing her within a period of 1 month made me think, stop, hold. You got to think of your life.
Okay.
You got to think of your health.
Yeah.
You got to think of your mental health, physical health. For you to cater and service more clients or more patients and take care of your family, you have to take care of yourself.
Exactly.
That was a turning moment for me, where I thought, if that moment did not happen, I would never take care of myself.
Yeah. Yeah.
And then realize taking care of oneself is also important to take care of someone else.
Yeah.
If you don't take care of yourself, how can you take care of other people?
Exactly.
So that was one of the things. And to start any practice or you should have a lot of patience. You should have time, family support. I still remember first 20 years, every Sundays I used to work. I never used to have a break. To take a break, it would be a big deal. Family suffered. I still remember I've lost all my first daughters, everything. I don't remember growing her up. Or by the time I realized, she was already into medical college.
Oh.
So maybe that's why friends of mine age, when we talk, they look for the grandchildren, where they can see where we have missed in our children.
Yeah. Yeah.
Those sacrifices which we do.
Yeah.
So it comes with part of being a doctor.
Yes. Again, the balancing, work-life balance is something plays a very major role, especially being a doctor. And then you said this is a turning point of yours, where you have realized you should take care of your mind and body. Unless and until you are not taking care of your mental health and the physical health, and including nutrition. And then, yes, of course, taking break, because initially first 10 years or 20 years you said you couldn't take break. So the break is also equally important, and the recovery, so basically for mind recovery for yourself. So this is a turning point. That's what you have mentioned. This is your iSPAN moments. So to conclude, basically we had a fantastic discussion with you. We have explored, and then we have actually spoke about myths, and then we have spoke about mental health, and then also we have decoded your iSPAN moments with us, and including your journey. And then this discussion definitely would reach a lot of people, those who are aspiring doctors, right? Your journey, the path and the journey what you have accomplished will help them. And then new parents out, basically there are a lot of myths, and then getting anxious. So that is something we are giving a good message to them. Dr. Vivekanand Kustagi, thank you so much out of your busy schedule. Yes, definitely being in the podcast, you have received a couple of calls too, and then even on Sunday. So your hats off to your commitment towards your profession. Thank you so much again, being part of our podcast today.
Thank you for giving me an opportunity to talk to you.
Yes,
thank you.
With our pleasure.
Thank you.
Yes.